A webinar to educate the public on COVID-19 vaccine safety is set to get underway. It is being hosted by the Government Communication and Information System in partnership with the National Press Club and the South African Health Products Regulatory Authority. The webinar comes as vaccination sites continue to see fewer people lining up for shots. Vaccine hesitancy has been identified as one of the causes for the lower than expected turnout. Officials are concerned that might prevent the country from reaching its target of vaccinating 70% of its population by year end. For more on what could be contributing to reduction in vaccine uptake, I'm joined by health journalist Lopez Gonzalez. Good morning to you. And we are seeing government saying that no, the uptake is not slow. It's just a myriad of factors that play here. But there are some serious concerns around what we are seeing unfold in our vaccination sites. Not a lot of people are queuing up.
Right. I think that you are seeing some very shocking pictures from Gauteng, for instance, of empty vaccination centers. There are some indications from reports from SABC in the Free State that that might not be a nationally representative picture, that some areas still might be calling for more vaccination sites, but it is definitely something that's the worry. I think that when we look at the research about what has been said about vaccine hesitancy in South Africa, I think that it points to two factors. One is vaccine hesitancy, and I think the other is the way that we are delivering vaccines in South Africa. So I think it's very heartening. Many people are very heartened by the fact that recent research shows that 3 out of 4 South Africans want a COVID-19 vaccine, that this is the norm. And I think that researchers have come out very strongly to say that this is a message that should be communicated to people in order to increase the uptake. But we also know that vaccine hesitancy is very complicated. It's not always about a lack of information. It can also be about the way that people perceive their risk of COVID-19 disease. It's also about time, convenience. And I think that this comes out in some of the recent data from the national survey that was done by a consortium of South African researchers that showed in that over 60 population, the population the government has said has a low turnout relatively. They've said that they've expected the older people in South Africa to come out in stronger numbers to be vaccinated. There was about 70% of people in that age group that said that they wanted a vaccine, but we see much less registration and much less vaccination in that group. So researchers are saying that indicates that something about the way that we are distributing vaccines may be making it difficult for people to access them.
And what does then the research say about potential ways of distributing in a way that is easier to, get people more and more involved in this?
Right, exactly. I think researchers are really, something that came out very strongly in that survey, researchers urging government to find new and innovative ways to get vaccines into people's arms. So you saw the Eastern Cape, Limpopo, moving to vaccinate elderly people at grant queues. You've seen also this kind of innovation within the HIV space, particularly under the hard lockdown in South Africa, where organizations that were delivering HIV medication to people were thinking about, can we Uber this to you? Can we drop it off at your house? Can we leave it in a locker that you can pick up? So making it really accessible to people. You're starting to see it in Gauteng, for instance, trying to court men to come get the vaccine that are coming out in lower numbers. Again, not something that should be surprising to us. Men usually come out for health services less frequently than women. So we had a similar thing with HIV historically. The move to start vaccinations in taxi ranks, that's been going on with HIV testing for more than a decade. So I think you certainly are starting to see government and provinces especially shift to try to figure out these ways to make it easier for people to access vaccines.
In terms of communication, we see even today we're told there's going to be a webinar later today that will be addressing some of the concerns and really taking people through the process of vaccination. But others are saying that there hasn't really been a targeted effort in terms of communication. Would you agree that government really does seem to not be able to be speaking in a targeted way here?
I think that, more and more people that I speak to, experts in the health field, I think would say yes, that government has had a serious failure in communication. I think government would probably disagree They've communicated much more focusedly, much more deliberately about COVID-19 than any other issue that I've seen in the last 15 years, and that includes HIV. I mean, even in the height of HIV, we didn't have weekly press conferences. We didn't have government experts making themselves available to media like they have so far. I think the difficult thing is when you start looking at vaccine hesitancy and what's been written about that, those concerns really become very localized and become very community specific. So, I think that journalists have done great work to try to explain the science, explain government's moves, what does this mean for you? But it's very hard for mainstream journalists to get into the nooks and crannies of the internet where vaccine hesitancy really thrives and where anti-vaccination advocates, right, so people who are wholly against vaccines are able to kind of populate Facebook groups and neighborhood groups and WhatsApp chats with that kind of disinformation that's really is really spreading quite quickly.
And when you look at the role, that the media has played, I saw the health minister talking about how the media, in fact, has been able to assist in getting information out there. Would you say that this has helped?
Oh, definitely. I think you've seen media across the board step up and really take the lead in explaining the science to people, addressing myths, doing what, in health you kind of call social listening, responding to the WhatsApps that they get, responding to the tweets. Media Monitoring Africa has done really innovative stuff, partnering with local citizens and also experts to try to pick up those kind of disinformation threads where they see them on social media. I think you've seen really innovative ways that people have tried to tackle this and really play, the role that journalism does, right, as an accountability monitor, but also as a real service to the public. I think that it's difficult when we start thinking about hyperlocal vaccine hesitancy trends, and that might require a different technique and maybe a technique that and an approach that is not one that usually resides within our health departments. If you look at who is a communication officer in our health departments, those are usually functions that are more political. They're there to answer queries from the media usually, but they're not really trained in the kind of behavior change communication that is usually used to kind of combat vaccine hesitancy.
Let's talk about the language of the people and what people really care about. Simple questions that they, seem to be asking and the answers that sometimes may not be forthcoming. People get to sites wanting to know, why should I wear my mask after I've been vaccinated? Why can I be, still get COVID-19? Why should I be hospitalized possibly even after I've been vaccinated? Those are some of the questions that they have. Others having questions around, SAPRA not being, forthcoming, especially when we heard of the investigation into the 28 deaths that people claim were saying that they were linked to them, their family members taking a vaccine. So some of these concerns are still milling around in the public domain. Do you think enough is being done to answer these questions in a much more pointed way? Because we do need to take them to account.
Right. I think that I think tracking adverse events or when people may have side effects in vaccines is complicated. I think the main message there that I'll just stress is that the side effects are very low with these vaccines. They're safe. They're proven to work. You really want, if you are eligible to get a vaccine, really right now is the time to do it. Countries all over the world, with much higher vaccine rates than we have, are struggling with the Delta variant. And it's not something that you want to put yourself or your family in a position to have to go through. I do think that more needs to be done to explain this. And I think that we probably need to start looking at how to capacitate and strengthen that message at a local level. I think that national media has somewhat addressed some of these things, but I think also in this pandemic, which is a little counterintuitive for journalists, right? We tend to like to do a story and then not come back to it. I think in this pandemic, there's really room to kind of continue to do some of those same. We may have answered that question before in terms of the Delta variant, but really to continue to kind of keep telling those stories because those questions are coming up, and certainly people want answers because rumors really are. And misinformation in some ways is really a response for some people about how to make sense of risk.
And lastly, when you look at the digital vibe scandal, one cannot even ignore it. Is it also playing a role in hurting the confidence here of, either the department or the drive in and itself?
I think definitely. I think the research across the world is very clear that vaccine hesitancy for centuries has been linked to a distrust of government. And, South Africa, I think in some ways is on the back foot. Many communities here do not see government as the face of service delivery. So there's already a gap in trust. And now we have the digital vibe scandal on top of the PPE scandals. And then we have, the health minister now saying to the Sunday Times this weekend that, the health department doesn't have enough money to conduct the kind of national campaign that would be needed to combat some of these issues around vaccine hesitancy. All of this is coming at a horrible time for vaccine confidence and definitely plays a part in fueling some of that vaccine hesitancy.
All right. Thank you so much for your time. That's health journalist Laura Lopez Gonzalez. We do appreciate your time.